Hi, my name is Zach just here at Fitmetabolism, and today I just wanted to go through a foam rolling sequence that you can perform before and after your workouts. We're going to do a lower body sequence first, and we'll go through an upper body sequence. What foam rolling is great for is to promote blood flow to tissue, specifically muscles, so that you're ready for your workout or activity. And then at the end of your workouts, it's to promote recovery and to remove blood flow through the tissue, so you can recover a lot quicker between your workouts. So basically, I want to go through step by step and muscle or tissue areas, or tissue by tissue, muscle by muscle, of what you want to try and hit the major areas. So we're going to start with the lower body first here. So you got your foam roller. I want you to basically just sit on top of the foam roller with your hands behind you. Both hips are going to be right on top of the ball, on top of the foam roller. And what you're going to do is, once you found that, you're going to slightly lean over to one side, or to basically get the glutes or the butt. So I'm on one forearm. I'm kind of leaning over to the side. I want to get tissue, not the hip bone or the pelvis bone. I'm just going to roll up and down, and you see the one knee's bent, one leg straight. I'm just going to roll up and down. There's, with foam rolling, you want to map the area that you want to target. So you're trying to find your trigger points or the most painful spots. When you do, then you can stay in that one little specific spot and just roll up and down for about 20 to 30 seconds. So there's two big areas of the glutes I always like to hit or target: the lower part of the glute, close to the glute medius, and then up in the upper part of the glutes as well, close to the pelvis. So for me, I'm tender in both spots. So that's the lower part. So just little rolls up and down, and then I'll go to the upper part. And then you're going to flip over to the other side. So same thing on the glutes. On the other forearm, use this the knee that's bent to push off on to go roll up and down. So I'm going to start in a larger surface area first. So just go up and down and see which tender spot. Once you find a tender spot, then you can just do little small rolls up and down off of it. That's both glutes there. Then we'll go to the hamstrings. So there's three areas of the hamstrings we're trying to hit. So you can do both at the same time if you like. I always recommend doing one at a time. So if I'm going to do my right leg, my hands are behind you. You're across the top leg, on top of the bottom leg. You roll up and down, right to the back, basically from the back to behind the knee and right to the top of the glute. If you find anything tender there, you can go on the inside of the hamstring, or the medial side, or you can go the outside of the hamstring. Now, I'm going to go on the outside of my hamstring here, because usually people have tight IT bands. You don't want to roll right directly on the IT band. That's not going to help you with anything. It's always going to be painful. That just tells you that the tissue on the sides of that IT band, so basically the lateral aspect of my hamstring, which I'm rolling out right now, is too tight, and the lateral aspect of my quad, which we'll deal with later. So same thing, if you find a little tender spot, just roll up and down. Same thing, 20 to 30 seconds, and then you can flip over to the other leg. So always start up large first to see if there's any tender. Once you find the tender spot, just stay in that spot and just roll up and down. You get a good upper body workout out of this. So once you've done the hamstrings, you're going to go into the upper calves or gastroc, and then the soleus or your Achilles. So same type of thing. You can do both at the same time if you like. I'm going to go single leg here. So there's two options. If you feel like your wrists are getting tired and your upper body's getting tired, you can keep your butt on the ground. But all that means is you got to really push this leg into the top of the foam roller as hard as you can to get that tissue. So I'm just going to kind of map out where my most tender spots are. There's a tender spot. I just roll up and down on it. If you want to get a little more specific, you can kind of do what you did with the hamstrings. My hips are off the ground, and I'm just rolling up and down in there. You go down to your Achilles or your soleus, which is the little lower part just above the ankle. Roll up and down. I'm going to kind of rotating my foot, trying to hit all areas of it to see which one's most tender. Right there is probably the most tender. I'm just going to roll up and down. And then you do the other calf. Once you've done the back side of you, basically, so you've done your glutes or your butt, you've done hamstrings, you've done your upper calves and your lower calves. Now you go to the front side of you, so I always like to go into the quads. So the quads are kind of like your front thigh muscles. Here, you're going to lie on your forearms, do both legs at the same time. So you can start right from the hips, roll all the way down the knees, and go up and down, trying to find the most tender spots. For me, it's kind of the belly of the the quad, which is kind of the middle. So I'm just going to go up and down there. To make it more specific, I can go single leg. And for me, if you have that tight IT band, don't want to roll right on the IT band, you want to roll on the lateral aspect of your quad. So my IT band is right on the side of me right here. I don't want to be doing that. You want to go on the lateral aspect of the quad and just roll up and down and you'll get that tender spot. So for me, right there is my tender spot. And then if you want to go the inside of the quad, you're just going to rotate. I'm just doing the vastus medialis, or the inner part of the knee. I'm going to roll up and down there. And then you go the other side. The next thing you're going to do is the tibialis anterior muscle. So think of your front shin muscle. So you've done the calves. That's that one right here. There's a couple options how you can do this. You can kneel right on top of it with both knees. And then you're kind of going to lean over to one side. So my butt's kind of in contact. I'm just going to roll, put all the pressure I can, and roll up and down in there. People who have problems with shin splints, this is kind of the area you want to hit as much as you possibly can to try to make sure that tissue around that tibia is ready for activity. Just rolling up and down. Once you've done the quads and you've done the front part of your shins, you're going to do the short adductor and the long adductor. That's kind of your groin. So the long adductor is closest to your knee. Your short adductors are close to your groin. So I'm going to go to, basically I'm going to go in a longitudinal way with my foam roller. I'm going to put my knee up. I'm going to go to the short adductor with the groin first. So I'm going to go as close as I can in my pelvis. I'm going to roll little ones up and down, put all the weight onto that roller. Just little small strokes. And then go to the long adductors, closer to closest to the knee. So you're here, and just get little small movements up and down, trying to put as much weight onto that leg that I'm trying to roll as possible. That's usually the problem when people foam roll is, they don't feel anything at all because they don't put any pressure in that spot. It just takes practice. And more repetition, you get better at it. So short adductors and the long adductors. So that's basically the lower body. Now we're going to go to the upper body. With this, I always like to start with both shoulder blades or scapulas. So you're going to foam roll on both scapulas just to see how tender those are. That's going to help warm up your rotator cuff muscles. So I'm going to find both shoulder blades with the foam roller. My hands are behind my head to protect my neck. I don't want to be using just my neck muscles here. Once you find it, you're going to lift your hips off like a little bit of a bridge, and you're just going to roll up and down straight on your back, basically. And my left side is a little more tender than my right, so I'm going to do the left side. So this is the top of your scapulas, or your shoulder blades. Spend about 20 to 30 seconds there. Then you're going to go into the rear deltoid or rear shoulder. So if you look, the rear shoulder, just kind of on the back side of here, there's a lot of tissue in there. Well, it's a big intersection of tissue. Basically, what you're going to do is when you're leaning, or you're on both scapulas or shoulder blades, you're going to kind of just roll over slowly. And I'm more on my side now. And you can keep your hips on the ground, and I'm just going to roll. It's a small little movement right up and down in that rear shoulder. And it takes practice to get used to, but I guarantee you're going to find some tenderness in there. So we've done both scapulas. Now we're doing the rear shoulder or rear deltoid area. And then now the other area. So the rear shoulder or rear deltoid is right kind of behind the shoulder. You're going to go to the lats. The lats are kind of the longer part of your back. So you're going to lean all the way over to your side and then just going to roll up and down. And for me, that's a tender spot, so I'm just going to stay there. As you can see, I'm using this knee to push up and down to get that spot. You do the other sides as well. So we've done both shoulder blades, the rear deltoid. You can do both sides, and then you've done your lats, the longer part of your back. And then the last one, here we go into for your upper body, is your chest. So think of your pec major, pec minor muscles. I'm going to lie facing down, but you see my foam roller is on an angle. I'm not directly vertical, I'm not directly horizontal, it's almost at a 45-degree angle. I'm going to put all my weight onto that foam roller right on top of my, my pec or chest. As you can see here, I'm going to use my forearms again. I'm just going to do little rolls up and down, put all my weight onto that foam roller. You're just going up and down, you go right to the shoulder. You'll find that tender spot. For me, it's right there. Just roll up and down. And then you can go the opposite side. And then the final area of your body you could foam roll with your foam roller before you start doing activity is the flexors of your forearms and the extensors of your forearms. So if you have some really tight flexor extensor muscles or tissue, if you sit at a desk all day and you're typing, that's usually where you want to get that tissue ready for contraction, full contractibility. So, so I'm going to do my flexors, which is kind of the flat part of your forearm. You just kind of put your arm up on it and you're just going to roll up and down as hard as you can. You may find one side a little more tender than the other. I always say whenever you're foam rolling, once you find your little specific areas that are really tender, and if it's really tender for you that day, then spend more time on it than the 30 seconds. My problem area, I always spend up to 60 seconds per position. So it's totally up to you. And then I'll go to the extensors, so just palms up, and roll up and down. Find that tender spot. Same thing, how much weight you put into the foam roller dictates how deep you get into that tissue. You're just warming up that tissue, getting some range of motion or mobility in that tissue as well, which will help when you're exercising, as well as after your workouts. So that is kind of the foam rolling sequence, the lower body first and then the upper body that you can perform on your own before you're ready for activity, as well as you can do after your exercise and activity. I hope you enjoyed it, and I hope you learned a thing or two.